How do we manage bedwetting in children? Bedwetting, also known as nocturnal enuresis, is a common presentation. At the age of 5 years old, up to 1 in 5 children wet the bed at night. At the age of 10 years old, up to 1 in 10 children still wet the bed at night. If you want to understand how to assess and manage nocturnal enuresis in children, then keep watching this video. Thank you for stopping by this video. If you're new to this channel, hi, my name is Dr. Erwin Kwun. I'm on a mission to help doctors lead a happier and fulfilled life. I make new videos every Thursday on the subject of GP training, well-being and high performance. Every Thursday I publish a new video. Make sure you subscribe to this channel so you don't miss any future videos. And don't forget to ring the bell so you're notified first each time I publish a new video. Let's get right into it. Working in general practice, I've encountered distressed parents who come in because their child is still wetting the bed. In order to manage enuresis, a doctor needs to start by assessing the patient, taking a focused history. Let me give you a working example. Toby, 5-year-old, was brought to the surgery by his mom. She tells you that he is still wetting the bed. How will you start the consultation? Who will you address first? When it comes to a pediatric case, it's important that you address both the child and the mom from the beginning. Building rapport with the child from the beginning will help you in the consultation later. Start with an open question to get a better understanding of the bedwetting. You might ask Toby, when did the bedwetting first start? Sometimes children may be shy and they will look at their mom if you're asking them a question. That's okay. If the child is not comfortable to answer the question, the mom will usually pitch in. Ask whether the child has ever been dry at night. This question will help you determine whether we're dealing with primary or secondary nocturnal enuresis. Primary nocturnal enuresis is when the child has never achieved consistent nighttime dryness. In comparison, secondary nocturnal enuresis is enuresis during sleep by a child who has previously been dry for at least 6 months. You might want to ask, how often does a child wet the bed? Is it happening once a week or is it happening at least twice a week? Does a child experience any pain when passing urine, any burning sensation? Also about bowel problems. The patient's bowel movement is key in nocturnal enuresis. If the child has constipation or is having soiling, then we need to exclude constipation, which could be the reason of secondary enuresis. Also about the child's use of toilet at home and at school. Some children are afraid to use a toilet. Explore whether the child has any daytime symptoms such as any accident. Inquire what the mom has already tried. Sometimes parents already read on the internet and try things for bedwetting. Ask the mom about the implication of the enuresis in the family. How has the family responded to the child? We need to know how the parents have responded to the bedwetting. If the parent is blaming a child who is bedwetting, then we can get more problems because of the emotional implication. Explore the oral intake of the child. How much fluid does the child drink over a day? Does the child drink any fizzy or caffeinated drinks? Make sure you cover red flags such as polyuria, polydipsia, any sudden weight loss, any concerns with the child's growth and development. Consider reviewing drugs history, any medications. The psychosocial aspects of the patient is important in enuresis. Is the child having any emotional upset or any stress? Is there any recent changes in the family? Has there been any separation of the parents? Does the child experience any bullying at school? Stress and emotional upset can also lead to enuresis. Also about family history of bedwetting. There's a strong association of bedwetting in parents with child who have a bedwetting problem. It is useful to elicit patients' ideas, concern and expectation and the parents' ideas, concern and expectation. We need to establish whether Toby thinks that he has a problem and how is he thinking about this problem. Sometimes parents might be worried. In this case, if you ask the mom of Toby what's been going on, she might tell you that she's worried that this could be diabetes because his dad also suffers with diabetes. There are a number of factors that predispose a child to have enuresis. Nocturnal enuresis is more common among boys than girls. It is also more common in obese children. Enuresis can also be observed in children who suffer with developmental delay. In your history, it's important that you identify any underlying cause of enuresis, such as constipation, UTI, diabetes mellitus, any behavioral or emotional difficulties that the child have been experiencing, any child maltreatment. Safeguarding in children is something that we need to be very vigilant. The next step in the consultation is to examine the patient. What examination will you perform for this patient? Based on your history, you might want to examine the patient's abdomen to have a feel whether there's any signs of fecal masses. You might want to examine the patient's weight and height and plot it on the percentile chart. Once you have taken a focused history and examined the patient, it's time to move on to clinical management. Education and reassurance are integral part of management in nocturnal enuresis. We need to educate parents that enuresis is a common problem and is usually self-limiting. We need to educate parents about not blaming the child for wetting the bed. Don't forget to address any concern that the parents may have. In this case scenario, Toby's mom was worried that he might have diabetes mellitus. How will you address this concern? You might want to offer a blood glucose test to exclude diabetes mellitus. You might also want to do a urine dipstick to exclude any infections. Depending on what the mom has already tried, you may recommend lifestyle changes. It's important to highlight to parents that restricting fluids is not something that's recommended, but to avoid caffeinated drinks. Waking and lifting are unlikely to help promote long-term dryness. By the way, have you found this video useful so far? If you like this video, you might also want to join Success Nation newsletter. As a member of our community, you'll receive exclusive happiness and success insights straight to your inbox. Sign up to join our community, link in the description below. I'll see you on the other side. You might want to recommend simple behavioral strategies, such as implementing a reward system, such as a star chart. It's important to explain to parents to reward behaviors that the child can consciously control and avoid rewarding dry nights, which is out of the child's conscious control. So rewarding behaviors such as drinking adequately, going to the toilet before sleep, and engaging in the management. Sometimes a potty by the bed may help if the child wants to empty his bladder at night. If you think the patient has constipation, make sure you treat constipation and optimize the patient's bowel movement. Depending on the severity of the bedwetting and the age of the child, a wait-and-see approach can also be considered. If the symptoms persist despite lifestyle changes and simple behavioral strategies, then a bedwetting alarm may be considered. Bedwetting alarm is a first-line treatment for nocturnal enuresis and is the most effective long-term strategy when used properly. Let me tell you a story about a mom who came in with his child who was still bedwetting, and they had a bedwetting alarm in place. I was a little bit puzzled when the mom said that the alarm has not worked and the child is still wetting the bed and the alarm does not go off. It turns out that the child has disconnected the alarm before going to bed, and mom was not aware. So it's important that the bedwetting alarm is used properly because sometimes children might disconnect the alarm before going to bed. Medical management of bedwetting include desmopressin. If a child is over 7 years of age and needs to go on a school trip or sleepover, and we need a rapid control of the bedwetting, desmopressin is a medication that should be considered. Patients requiring bedwetting alarm or consideration for desmopressin should be referred to the bedwetting clinic where there's specialist input. Make sure that you offer safety net advice to the mom if symptoms don't improve to seek medical attention and consider arranging follow-up for the patient. Let me know down in the comment section if you have any suggestions or any comments as to how you would manage a child who comes in with bedwetting. If you found this video useful, you might also want to watch a video I made on how to take pediatric history. I cover in much more detail how to take a good pediatric history. Thank you for watching this video till the end. Take care everybody. Bye bye.